Hi, my name is Leanne Poliza. I am a nursing student at Frontier Nursing University, and this presentation is on how to promote physical activity in rural populations. I would like to share this PowerPoint. Only about half of Americans get the amount of physical activity recommended, and rural populations are less active than urban populations. Physical activity is useful for disease prevention, stress reduction, and managing chronic diseases such as obesity and cardiovascular disease. Rural populations have health disparities, values, and environments that may pose barriers to physical activity. And the purpose of this presentation is to discuss disease prevention, health equity, quality of life, and the economic impact of the benefits of promoting physical activity to rural populations. Because rural populations have health disparities, values, and environments that may pose barriers to physical activities to these special populations. And these barriers are unique to each rural community and can include things such as inadequate transportation, poverty in rural communities, and limited access to the use of quality recreational facilities. These challenges are unique to each individual rural community. And there are a number of tools available to evaluate the supports and barriers to each rural population and community. And these tools are essential in assessing the communities and implementing policy interventions to help the residents of these communities. Rural populations have higher rates of chronic disease and they're less physically active than urban populations. Over the past 30 years in America, the prevalence of obesity, which follows a social gradient, according to Barnage, is published in 2013, quote unquote, a social gradient, meaning income. It has continued to rise, and approximately 1/3 of adults and 17% of children in the United States are now obese. Health equity and quality of life is very important in rural America because 15% of the United States population now live in rural areas. They have higher incidences of obesity and a lower quality of life overall. Differences such as increased poverty in these areas, rural values, social norms, and decreased accessibility to healthy foods, as well as behavioral factors, and even the rural environment itself may promote obesity in rural populations. It's important when assessing these areas that a regionalized approach be taken into consideration. There is a decreased tax base, and so regionalized approaches when dealing with rural populations have shown to be effective. Shared use agreements with local schools, hospitals, and businesses, using nonprofit centers such as churches and other organizations have been effective in promoting physical activity to rural populations. There are certain environmental influences that come into play when promoting physical activity in rural populations. Built environments, natural resources that are available, organizational involvement, and policy interventions. Rural populations that get more physical activity are usually associated with better planned town centers with increased walkability and safety features. Populations that get less physical activity always report barriers such as isolation, lack of adequate transportation, lack of access to recreational opportunities, safety concerns such as stray animals, climate or terrain, and crime. In rural areas, organizational involvement and policy interventions are always important. Because of the lack of income and the increased poverty areas in these areas, and often a lack of centralized government and a lack of zoning regulations, it's important to use resources that are already available to these populations and shared facilities that might also be available, such as school gymnasiums, city parks, recreational facilities, and public lands that the populations might already have ready access to. It's important to have effective organizational involvement and shared space use. Effective organizational involvement is key to shared space use. In a study conducted by Lowe in 2017, the consensus of rural focus groups was that shared facility space was not always adequate for adult populations. The quality and type of resources, along with limited availability for working and senior adults, was considered a barrier to physical activity and utilization of mixed and shared facility resources. Organizations can promote the benefits of physical activity to rural populations by utilizing approaches that mold physical activity around current values of the community. Some rural communities do this by involving organizations and senior citizens, such as senior citizens programs, or involving schools and school programs that provide additional transportation to populations that live in remote areas or in rural areas. It's important when utilizing services in rural communities that they all consider the values, because each community is different. It's important to engage rural residents to adopt physical activity as a way of life if they want to sustain a long-lasting success for any program. Clinicians should look to align goals with personal values, such as suggesting walking with family members or church organizations. Correlating decreased cholesterol levels with increased levels of physical activity in individuals would be another way of doing that. Engaging groups of organizations of similar interest or ages to organize for exercise groups would be another way, as suggested by Park in that research study that was conducted in 2017. In conclusion, regular physical activity has been shown to serve many benefits to health and well-being. This is a way to provide better health equity to those rural populations. Each rural community is very different in and of itself and should be assessed and engaged differently, as accorded by Barnage in the research conducted in 2013. It's important to assess each community differently and develop plans based on the needs and values using the resources that are readily available in each rural community. Collaboration with existing agencies based on the resources and values of each community is essential for lasting success. Thank you.